Now let's talk about antimicrobial drugs, which is antibiotics that can be used. Example are penicillin, erythromycin, amoxicillin, tetracycline, aminoglycosides such as gentamicin and tobramycin. Uses: it used to prevent or treat infection caused by pathogenic microorganisms. Make sure a culture has been obtained before giving the first dose. Check for allergies because most patients are allergic to antibiotics. Peak and trough should be drawn for aminoglycosides and vancomycin too. Peak should be drawn 1 to several hours after the drug is given, and then trough should be drawn immediately before the next dose of the drug is given. Assess IV site for phlebitis. Monitor for thrush, yeast infection, and diarrhea. These three side effects, thrush, yeast infection, and diarrhea, is called superinfection and usually is common when patient is taking antibiotics. Monitor for white blood cells. The antibiotics usually should work between 24 to 48 hours. The patient should be feeling better. Now let's talk about anti-lipemic agents. Example: cholecystiramine, clofiprate, cholestyramine, propofol. Uses: it's used to lower cholesterol. Make sure you increase fluid intake to prevent constipation. Also monitor for cholesterol level, which should be less than 200. Now let's discuss about antiplatelet agents. Example of antiplatelets are aspirin, dipyridamole, ticlopidine. Uses of antiplatelet agents is used to inhibit the aggregation of platelets to form a plaque. Platelets do not initiate thrombus formation as readily when taking antiplatelets. Make sure you take with food to decrease GI irritation. Monitor for bruising, bleeding, gums, nosebleeds, and terry stool. Now let's discuss about calcium channel blockers. Example of calcium channel blockers are diltiazem, nifedipine, and verapamil. Uses: produces vasodilation and decrease myocardial contractility. Monitor blood pressure. If the blood pressure is less than 90/60, you hold and let the doctor know, or heart rate less than 60. Monitor also for orthostatic hypotension. Let's talk about diuretics. Example of diuretics: there are three types. Thiazide diuretics, example is chlorothiazide. Loop diuretics, example is furosemide or Lasix. Potassium sparing, example spironolactone. Monitor for potassium levels. Do not give if the patient has hypokalemic, which is potassium level less than 3.5, or hyperkalemic, potassium level greater than 5. Monitor for intake and output. Monitor blood pressure and orthostatic hypotension. Monitor for weight gain and report if it's more than 2 pounds in a day. Uses of diuretics: it's used to decrease blood volume, which decreases the workload of the heart. Now let's talk about thrombolytic agents. Example of thrombolytic agents are Antiplatelet, which is TPA, streptokinase, urokinase. This is a critical medication, usually is given in critical care settings such as ICU. Uses: dissolve thrombi or emboli, monitor for internal bleeding, follow a facility protocol when giving. Now let's discuss about narcotic analgesics. Example are morphine, codeine, hydrocodone, propoxamine. Uses: is used to relieve pain. Is a class Schedule 2 drugs. Medicate patient according to pain scale of 1 to 10. Bed should be in a low position. Side rails should be up, but it depends with facility protocol since bed rails are considered restrained. Call bell. Make sure the call bell is within reach. Evaluate effectiveness of the medication in 30 minutes. Monitor respiratory status because narcotics causes respiratory depression. Now let's talk about vasodilators. Example of vasodilators are hydralazine, dioxide, sodium nitroprusside. Uses of vasodilators are used to decrease preload and afterload. Arterial dilators. It causes dilation and decreased peripheral vascular resistance. Monitor blood pressure. Patient should have cardiac monitor when giving through IV. Keep patient on bed rest. Maintain safety precaution. Thank you for watching my video. If you like it, please subscribe and share with your friends.